Hi everyone, I'm I'mHollyElizabeth and welcome back to my channel. If you're a nursing associate or a student nursing associate or you're just thinking about becoming one, then this video is for you. Today we're talking about clinical skills that every nursing associate uses in day-to-day practice across the NHS. Not the flashy stuff that you just do sort of once in a blue moon, but the core skills that you'd use every shift. So sit back, relax, grab a cup of tea, and let's just get straight into it. So first up, there's observations. So as a nursing associate, it's very important that you know how to check observations and you kind of know what you're doing. Observations include blood pressure, pulse, oxygen levels, respirates, temperature, pain score, and following the news too scoring system, pretty much. As a nursing associate, you're not just taking obs, you're recognising abnormal results, escalating concerns if you need to, repeating vital signs if required, and you're also documenting. But the main thing is you're noticing when a patient's not well and clinically deteriorating, and you know how to escalate that appropriately and work within your scope of practice whilst doing so. You're often the first person that will notice when a patient deteriorates or is deteriorating, and that matters. So it's important that you have a good idea on what you're doing with that, you know. The second thing that you will do is personal care and hygiene. As a nursing associate, when you are assisting with personal care and hygiene, you're not just washing someone or taking them to the toilet, you know? You're also assessing skin integrity, pressure sores, any changes in a patient's mobility, any confusion, and you can also assess the pain whilst doing so. Nursing associates play a key role in pressure ulcer prevention and maintaining a patient's dignity, which is fundamental to safe care. Infection control is also something that nursing associates practice constantly, as I would hope all healthcare staff would. This includes hand hygiene, wearing the correct PPE, following the aseptic technique when required and if trained to do so, cleaning equipment properly when needed, and following any barrier precautions or isolation procedures. Whether you're on a ward, community, mental health, GP practice, wherever you are, infection control is non-negotiable, and nursing associates are kind of at the centre of that along with nurses. So documentation is a clinical skill and a legal one too. As a nursing associate, you're regularly writing patients' notes, putting their observations on the system, recording their observations, updating care plans, and just using, wherever you work, using their sort of system and their record keeping procedures and policies. Does that make sense? I don't know if it does. Good documentation protects the patients, the team, and it protects you. So yeah, write it down or it didn't happen, okay? We all know this by now. One of the most important skills that nursing associates use is communication. That includes communicating with patients and their families, handing over using SBAR, the SBAR technique, escalating any concerns where required to, you know, registered nurses, doctors, or, you know, the wider MDT team, and also when advocating for patients too. Knowing when and how exactly to speak up can save patients' lives, so nursing associates are expected to do exactly that. Then you have sort of your basic clinical procedures. Depending on your setting and training, nursing associates will carry out clinical skills such as blood glucose monitoring, taking patients' bloods, urinalysis, catheter care, wound care, and monitoring fluid balance. In our trust, we also do ECGs, we have the training for that. Cannulas as well, cannulation. So there's all sorts of skills that you can do. So don't forget to always work within your scope of practice, following trust policies and guidelines, and make sure you have the right training before you perform any of these clinical skills. But these are everyday clinical skills for nursing associates in many roles, you know. Finally, a skill that gets overlooked: professional accountability. Nursing associates are NMC-registered professionals, which means working within the code, understanding your scope of practice, reflecting on your work, and escalating when something just isn't right. This is what makes the role different from unregistered support roles, and it's something to be proud of, so well done. So those are some of the key clinical skills that every nursing associate uses in their practice. If you're a nursing associate watching this, you're probably doing more than you give yourself credit for. If you found this helpful, leave a like, subscribe if you want, and drop a comment below. What clinical skills do you use in everyday practice? I'd be really interested to know from different clinical backgrounds and even different clinical roles. So let me know if you want. Thanks for watching, and I'll see you in the next one. Bye!